So today is December 30th, and I wanted to give a kind of an update because I'm going to be getting my PICC line out in about 10 days or so. And it's been 3 months of antibiotics, and I'm kind of nervous but excited to get rid of George. This is George. George, say hi. Hi, George. George shakes with my atrophied muscle, but there's George in all of his splendor and glory. We named him after my doctor that's treating me for Lyme disease because we've been really fortunate to have somebody that really is proactive about treating it. So everything has been getting better, so I'm excited about that. This eye is definitely getting better. My mouth is almost completely better. I can drink without a straw now, which is amazing. My smile is still kind of crooked, and this eye doesn't open, but it's doing a lot of fluttering. So I kind of wanted to go through what a typical day is like for me when I wake up in the morning. So I'm going to do my best because the camera doesn't always agree with me. So first what we have is we have one antibiotic. This takes me about 10 minutes to push through my PICC line, and I do this every day. All of these I do every day in the morning. And then we have 2 saline flushes. You do one before the antibiotic, and then you do one after the antibiotic to make sure it went through your PICC line. And then we have a dose of heparin just to clear the line to make sure that there are no clots. And then there are alcohol swabs, obviously. When my nurse comes, here's a dressing change kit. It has a big Tegaderm, a cool mask, some gloves, an alcohol swab they use to kind of clean up George. And then we have a bio patch, and they put this on. You can see mine is right here. It's like an antimicrobial, so that's good for germs. And then we have an extension. That's the long tube you see dangling right there. And then this, you can't really see it, but it's the stat lock. So it's the thing with the blue arrows on it that kind of holds my PICC in place. It has like locks on it, which is good because I used to sew them on, so I'm thankful for that. So this is kind of my supplies. This is what they look like. I have 4 boxes or so of supplies, which I'll be really happy to get out of my dining room. So kind of what I have is I have one bag. This is like miscellaneous stuff. I have like a shot of epinephrine, Tegaderm, Benadryl, random needles, just really random stuff that I haven't used in 3 months. These are the little like sack coverings. They're really ugly. I'll show you one that they give you. As you can see, I use my own sack because this draws a lot of attention and they're ugly. So I don't use those too much. A huge bag of alcohol pads, which I'll probably never use in my lifetime, but we have them in case of a fallout. And then I just have some more dressing change kits for when my nurse comes. Next we have a box. We have tons of saline that are all individually wrapped, and then these are my heparin flushes that I do. The next thing, hopefully you can see this, is about, let's see how big it is. It's about 1 month's supply of all of the medicine that I have put in my body through my IV. And we have another huge box of it in the garage. It's pretty ridiculous. I feel like they should be able to reuse them or something instead of going in a landfill, but wishful thinking. This is lab in a box. So when the nurse comes, they can just pull out, there's like a little styrofoam cooler, and then it has like the little vials of blood that they draw from my PICC, and they can put them in there, and then UPS comes and picks it up. Very fancy. It's nice because I don't have to get stuck all the time or leave my house to do labs, so that's good. And last but not least, I was lucky enough to get my very own Sharps bucket, which sadly is like really full. And that's for the times that sometimes my PICC gets backed up and they have to draw from my other arm, or I've had to get certain medicines that they have to like draw out with a needle, and then they will throw that in there. So this has kind of been my life. for the past 3 months, and I'm excited, scared, and nervous to get rid of the PICC line, but I think it will be good for me because I can get back to some kind of exercise and take the longest shower of my life, which I'm really looking forward to. So that's the update. 3 months of Lyme disease being treated for Lyme with IV antibiotics. Bye.